Did you know that memory loss and dementia aren't always just a natural part of aging? Some of the most common medications used by millions every day could be silently harming your brain and increasing your risk of dementia. While they may treat other health issues, their impact on your memory could be far more serious than you think. This video will reveal 7 medications that will lead to dementia. Alzheimer's and other types of dementia are heartbreaking, not just for those affected, but also for their loved ones. Right now, there isn't a cure, and treatments for Alzheimer's only slow down symptoms a bit. They don't reverse the disease. Often, it's hard to tell if medications are making much of a difference at all. Experts think dementia cases will rise in the coming years, so understanding what causes it is crucial. While people once believed memory loss was just part of getting older, research now shows it's linked to harmful changes in the brain, like the buildup of certain proteins. Well, health lifestyle choices like eating well, staying active, staying mentally engaged, and managing stress can help protect brain health. Avoiding risks like alcohol abuse, smoking, and head injuries can also make a real difference. Preventing dementia isn't simple, but research shows that good habits go a long way. In this case, certain medications, often prescribed for other health issues, can negatively affect memory and cognition. The following 7 medications have been identified as particularly risky. Number 1. Benzodiazepine drugs. Benzodiazepines, like Xanax, Valium, and Ativan, are often prescribed to help with anxiety and sleep issues, offering quick relief for short-term use. However, long-term use can lead to serious problems, including memory loss, a higher risk of Alzheimer's, and dependence that makes stopping them challenging without side effects like confusion or agitation. These drugs disrupt brain chemicals and sleep patterns, which are both essential for mental health. In older adults, benzodiazepines increase the risk of falls, breathing issues, and further cognitive decline. Doctors suggest safer alternatives to benzodiazepines for managing anxiety and insomnia. Approaches like cognitive behavioral therapy, mindfulness, and regular exercise can be effective without these risks. Certain antidepressants, like SSRIs, may also help with fewer impacts on memory loss. For those looking to stop benzodiazepines, it's vital to gradually decrease under medical supervision to avoid strong withdrawal symptoms. Number 2. Proton pump inhibitors, PPIs. Proton pump inhibitors, or PPIs, are commonly prescribed for heartburn and acid reflux, with popular names like omeprazole, lansoprazole, and esomeprazole. These drugs work well to reduce stomach acid, but using them for a long time may come with hidden risks. Research has found that prolonged PPI use can increase the risk of memory issues and dementia. One reason is that PPIs reduce the body's absorption of vitamin B12, which is essential for a healthy brain. Additionally, PPIs can impact gut bacteria, which also plays a role in brain health. Moreover, a study of over 6,000 people found that around 10% of those taking PPIs for 3 or more years experience memory loss. Another concern is that long-term PPI use may cause protein buildup in the brain, which is similar to changes seen in Alzheimer's patients. Although this doesn't mean PPIs directly cause dementia, it's good to be aware of the potential link. Doctors usually recommend limiting PPIs to shorter periods, 2 weeks to 3 months, and advise consulting a healthcare provider before extending use. If you're taking PPIs, talk to your doctor about possible alternatives to manage acid reflux without compromising your brain health. Number 3. Anticholinergics. Anticholinergic medication are often prescribed for various health issues, from bladder control and respiratory disorders to Parkinson's disease. They work by blocking acetylcholine, a neurotransmitter that's essential for learning and memory. But there's a downside. Studies show that regular long-term use of these drugs can raise the risk of dementia, especially in older adults. A well-known example is diphenhydramine, found in Benadryl, which many people take for allergies or as a sleep aid. Other common anticholinergics include oxybutynin for bladder issues and certain antidepressants. In a major study of over 3,500 older adults, those who frequently use anticholinergics had a 54% higher risk of dementia. Another large study also found that high doses of these medications are linked to brain cell damage and declining mental functions. Beyond this, acetylcholine, the brain chemical these drugs block, plays a big role in memory and movement. Alzheimer's patients often have low acetylcholine levels, which may explain why blocking it over time could harm memory and cognition. If you're taking anticholinergics, it's wise to talk to your doctor about safe options. Some medications like donepezil, which increases acetylcholine, are used in Alzheimer's treatment and might offer a better approach for those concerned with cognitive health. Being aware of these risks can help you make informed choices about your brain health as you manage other conditions. Number 4. Corticosteroids. Corticosteroids, like prednisone, are strong anti inflammatory drugs used to treat asthma, allergies, and autoimmune diseases. They're effective for reducing inflammation, but long term use, especially in oral form, can impact the brain, leading to confusion, memory loss, and even a higher risk of dementia. A major study in the UK, involving over 500,000 people, found that extended corticosteroid use was linked to a noticeable increase in dementia risk. These drugs work by altering levels of cortisol, the body's stress hormone. When cortisol stays high for too long, it can damage the hippocampus, which is part of the brain that manages memory. So while corticosteroids can help control many conditions, using them over an extended period can harm brain health. In addition, corticosteroids are often necessary for managing conditions like allergies, respiratory issues, and autoimmune diseases because of their powerful effects on inflammation and immune response. However, experts recommend using these drugs cautiously and at the lowest effective dose. If you're taking corticosteroids long term, talk to your doctor regularly to review your treatment. There may be ways to reduce the dosage or explore alternative treatments that could be safer for your brain in the long run. Number 5. First generation antihistamines. First generation antihistamines like diphenhydramine, found in Benadryl, and chlorpheniramine are popular for easing allergy symptoms. However, they come with hidden risks, especially for memory. These older antihistamines block acetylcholine, a brain chemical important for learning and memory. Prolonged use has been linked to memory problems and a higher risk of cognitive decline, especially in older adults. Research that analyzed 138 studies found a strong connection between using these medications regularly and an increased risk of dementia. Many long term users even reported memory loss and trouble focusing, sometimes even after stopping the medication. Thankfully, safer options are available. Second generation antihistamines, like loratadine, Claritin, work effectively for allergy relief but don't carry the same cognitive risks. These newer antihistamines don't interfere with acetylcholine in the same way, making them a better choice for long term use. If you're using first generation antihistamines often, talk to your doctor about switching to a second generation option. Managing allergy symptoms is essential, but it's just as important to choose medications that support long term brain health. Number 6. Amphetamines. Amphetamines, like Adderall, are commonly prescribed for ADHD to help with focus and concentration. They work by boosting certain brain chemicals, like dopamine and norepinephrine. While this can improve focus in the short term, long term use has some concerning effects. Over time, these drugs can lead to dependence, irritability, and even memory issues. People who rely on amphetamines for years may face an increased risk of cognitive problems as they age. In this regard, studies suggest that long term amphetamine use could be tied to brain changes linked with dementia. When the brain is regularly exposed to amphetamines, it may go through certain changes to adapt, which could eventually lead to mental decline in later life. There's also a theory suggesting that while amphetamines may feel helpful initially, they might create an internal opposite effect over time, eventually harming memory and cognitive function. Additionally, research points to connections between amphetamine use and brain conditions, like oxidative stress and inflammation, both of which are associated with dementia. Doctors recommend keeping doses as low as possible and exploring alternative therapies to reduce long term risks. Being mindful of these effects and considering other treatments can be essential for protecting memory and brain health as we age. Number 7. Tricyclic antidepressants. Tricyclic antidepressants, like amitriptyline, have been used for years to help treat depression. They've helped many people, but they also come with some significant side effects, especially related to memory. Studies show that people who take these medications regularly may experience faster memory loss and cognitive decline compared to those who don't use them. Older adults, in particular, are at a higher risk of these problems. Further, these medications cause memory issues because they block certain chemicals in the brain that are important for memory and learning. They have strong anticholinergic effects, which means they interfere with the neurotransmitters needed to remember things. Luckily, there are safer options today, like SSRIs, selective serotonin reuptake inhibitors, which don't have the same impact on memory. If you're taking a tricyclic antidepressant, it's worth talking to your doctor about switching to something with fewer cognitive risks. This way, you can get the help you need for depression without worrying about affecting your memory and brain health in the long term. Always be sure to weigh the pros and cons and find the best treatment for you. Are you already taking any of these medications? If so, you know what to do. If you like this video, then you must hit the like button and subscribe to the channel.